Hello everyone, and welcome back to Navigating the Periphery. My name is Deborah, and this, no surprise, is my son Philip.
Hello!
How is everyone doing today? If you're into what we're doing on this channel, you guys know what to do. We want to try and get our message out there and try to reach and help as many people as we can. Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis, one show at a time. If you know anyone who could benefit from watching this channel, please help. Spread the word.
Remember, it's okay not to feel or be okay all the time. You are not alone. We're here.
We are. So, Philip, how are you doing today?
I'm doing great today, Mom. How about you?
I am good and excited to discuss today's topic.
First and foremost, we are not medical doctors. Our channel is for information and education purposes only. And I'm speaking to you guys out there from my personal life experience with OCD, GAD, and my schizoaffective disorder, from the patient's point of view.
Yes, and my perspective is the parental perspective of having a child with those diagnoses.
Yes, so please refer to our full disclaimer at the end of this video and every episode that we put out. Today, we are going to navigate the periphery of how the depressive symptoms of my new schizoaffective disorder mixed type diagnosis is affecting my agoraphobia and hypervigilance with safety. Man, that was a mouthful.
Indeed it was. Breathe. Schizoaffective disorder mixed type and agoraphobia are both serious medical conditions that, when occur at the same time, it can create a complex and very challenging situation. Understanding how they interact can provide insight into managing symptoms and improving one's quality of life. Schizoaffective disorder is a mental health condition that combines symptoms of schizophrenia, such as hallucinations or delusions, with mood disorder symptoms, depression, and/or mania. The mixed type refers to cases where both manic and depressive episodes are present along with the psychotic symptoms, and this makes it much more challenging to deal with.
Agoraphobia is an anxiety disorder where individuals have a fear of situations or places that may cause panic, embarrassment, or feelings of helplessness. This fear often leads to avoiding situations where escape might be difficult, such as crowded places, open spaces, or being outside the home. Some of the common triggers include fear of leaving the house, fear of crowded places like malls or the movies, fear of enclosed places like elevators or public transportation, and agoraphobia can become so severe that individuals become housebound, avoiding almost all social interactions or outings. And hello, that's me.
You might want to keep your hand raised throughout this episode.
Maybe.
When schizoaffective disorder and agoraphobia occur together, they can reinforce or bolster each other in several ways. Sometimes psychotic symptoms intensify agoraphobia, delusions, or paranoia associated with schizoaffective disorder, and it may heighten the fear of leaving home. For example, someone experiencing paranoia may believe they're being watched or followed, which can make public places feel overwhelming and dangerous.
This happens to me a lot, which makes it hard for me to do everyday things. This can be very emotionally taxing to deal with daily.
During depressive episodes, the individual may feel too hopeless or drained to leave their home, exacerbating agoraphobia. Conversely, during manic episodes, the person may feel overly agitated and avoid public places due to the chaotic and uncontrollable nature of their thoughts. The combination of psychotic and mood symptoms may lead to increased isolation as individuals withdraw from social situations due to fear, the agoraphobia, or mental distress, the schizoaffective disorder. This social isolation can worsen both conditions.
I have been isolating a lot lately. Now, I'm not sure if this is because I stopped taking Abilify, which may have helped my anxiety and depression, but was not worth the side effects it was causing. Now, just to reiterate, I did not just stop my Abilify. I had to come off of it slowly under the supervision of my new psychiatrist. You should never just decide to stop any medications without consulting your healthcare provider. As many of you know, agoraphobia tends to involve avoidance of places or situations that trigger anxiety. For someone with schizoaffective disorder, psychotic symptoms like paranoia can make the avoidance worse, leading to a cycle of staying home to feel safe, which reinforces the phobia, which in turn reinforces more isolation.
Isolation due to agoraphobia can cause individuals to become more absorbed in their psychotic experiences, as they have fewer distractions or social support. This isolation can deepen delusions or hallucinations. This can also increase mood instability. The mood swings associated with the mixed type of schizoaffective disorder can make agoraphobia more unpredictable. On some days, a manic episode might give the individual the energy to confront their fears, while on other days, depression or paranoia could prevent them from leaving the house entirely.
Which again, is me. I guess this is another episode where I should leave my hand up the whole time.
That's what I said before. Well, the show does revolve around you.
Yes, I guess it does.
Managing both schizoaffective disorder mixed type and agoraphobia typically requires a multidisciplinary approach involving medication, therapy, and support systems. Basically, a combination of things. The key to treatment is addressing both disorders in a way that tackles the overlap between them. So regarding the medication side of the equation, antipsychotics would be used to manage psychotic symptoms such as hallucinations and delusions. This would help reduce paranoia or delusions that exacerbate agoraphobia.
So for me, that would be my Geodon. Also, mood stabilizers. Medications like lithium or anticonvulsants can help balance the manic and depressive episodes in schizoaffective disorder, which would be my new medication Lamictal. And antidepressant/anti-anxiety medications for the depressive episodes and anxiety related to agoraphobia, that would be my Cymbalta.
Then there's also behavioral therapy, and it's crucial that therapy addresses both the psychotic symptoms and the agoraphobia. So working with a therapist experienced in treating both psychosis and anxiety disorders is crucial. And fortunately, Philip's psychologist is very experienced in both fields.
And also, graduated exposure therapy can help this. This is when individuals gradually face their fears, like going outside, in a controlled and supportive environment. Over time, this helps reduce anxiety, but I'll be honest with you guys, I have been really struggling lately, and I'm not ready to do that yet. Hopefully, when my Lamictal starts working, I can revisit this.
Absolutely. Whenever you are ready. Support from loved ones can help break the cycle of avoidance in agoraphobia and provide a sense of security when dealing with the unpredictable nature of schizoaffective disorder. Also, support groups for people with schizoaffective disorder or agoraphobia can help reduce isolation, provide coping strategies, and offer a safe space for expressing fears and challenges.
I have definitely been considering that as well. Sharing concerns with trusted friends or family can reduce the isolation that comes with depression and hypervigilance. Addressing hypervigilance, especially when linked to feelings of safety and depression, often requires a combination of psychological, medical, and social interventions. So, I'll let you guys know how this plays out in the future. Thanks for being on this journey with me and my new diagnosis of schizoaffective disorder mixed type. This channel has also helped me greatly, doing research and keeping my mind occupied and reaching out to you guys out there. If you think about it, having the channel and you guys seeing my face kind of makes me agoraphobo-genic.
Yes, it definitely does. You're really funny when you really want to be.
Thanks. I try.
Wow. That was like from the 50s. Agoraphobo-genic. I love that. We should trademark that.
Thank you guys so much for watching today. Please remember that it's okay not to be okay all the time. You guys out there are not alone.
Yes. And that on Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis one show at a time. So until we see you again on our next episode, coming really soon, from my agoraphobo-genic son and I to you guys, please take care. Bye for now.
Bye.